The coronavirus pandemic has radically changed our daily lives. Social distancing and stay at home are now a daily focus. But reopening the country has now entered the conversation. And whether it's our president or the CDC or our international friends, when people talk about reopening the country or the economy or the world, they talk about testing. So I thought it would be good to spend a few moments to talk about testing, where we are now, and what it could mean for our future. Initial discussions around testing were all about detecting the virus itself. Let me show you what that looks like on a graph. It all starts with exposure. The virus enters the host and begins to replicate. At some point, the host becomes symptomatic, but we know days before then there's enough virus on board that that patient is actually contagious. Nonetheless, the virus continues to replicate. Your body responds by mounting an immune response, and eventually your body, in most cases, are able to overcome the virus, kill the virus, and then the virus leaves the body. Most of the early testing was focused on finding the virus itself. It's a swab test, either in the nose or the throat, sent to the lab, and through a method called PCR, the actual virus is detected. Now, that sounds like a good idea, of course, but there are some challenges. One is the reliability of the test. Remember, all these tests initially were done at the CDC, and now we have better tests that are more reliable. The second issue is availability, right? Initially, the testing criteria was very strict. You had to have fevers, dry cough, shortness of breath, otherwise you wouldn't be tested. Now, because there's increased availability, increased reliability of the test, we're using these tests for the virus more and more. The problem is 50 to 80% of people are asymptomatic. So you could only detect the virus during the active phase, but if you have no symptoms during that phase, how do you know when to test? For all those reasons and more, there is increased interest in testing not only for the virus itself, but also antibodies to the virus. Remember what we said, the virus has a natural course to come, increase its numbers, and then is killed off by the host, by the body. How your body kills the virus is through an immune response. It produces antibodies. Those antibodies stay in the blood. So if we look at the antibodies, we could find not those people who have an active infection per se, but those who have been previously exposed to COVID-19 and now have a healthy immune response, therefore could not be reinfected. Let's look at that on the graph. It all starts with exposure, and remember, the virus replicates until your body produces a response to kill that virus. That's indicated by the blue line here. So your body produces antibodies specific to COVID-19 to kill the virus. This decreases the volume of the virus and ultimately cures the illness. Even after the virus is gone, the antibodies continue in your blood. Testing for antibodies is then very interesting, because you can find those people who have already been exposed to COVID-19 and have developed an antibody. This is what people talk about when they're talking about documenting immunity or offering immunity card. If you have the antibodies to this test, you should not be able to share the virus or become infected yourself. Now, just like what we said with the other tests, these tests have their problems. They're new. And the biggest issue we're having is the reliability of the test. Now remember, testing for the virus is a swab, but testing for the antibodies is a blood test. You can do those in two ways. A point-of-care test where you prick your finger and just a small drop of blood is evaluated, or you can have a standard blood draw and send it to the lab. Those point-of-care tests, although convenient, are less reliable than the lab test, but really all of them have been plagued with problems with reliability. Availability of these antibody tests is also an issue. Now, to help with this, the FDA has allowed the sale of some 95 antibody tests in the US. The problem is, of those 95, only 3 have been formally approved and reviewed through our FDA. So again, even those available may not have the reliability that we want. There's a strong desire to get back to somewhat of a normal life. Testing offers one tool to help us do that safely, but it's just that. It's one tool, and as we discussed, perhaps an imperfect tool. But that tool should be used along with education and social distancing, and yes, a graduated return to full activity. COVID-19 will lose. I look forward to recording that video soon. In the meantime, if you have questions, reach out, comment below if you'd like, share the information if it's helpful. Stay well.